So listen, we've known from the start that breakthrough infections are possible, but how does what we've learned in the last few months affect what happens next? Well, infectious diseases specialist Dr. Zain Chagla joins us now to talk about that. So, Dr. Chagla, what do we know about why fundamentally we are seeing breakthrough infections? Like, is it primarily because we're getting, further and further from when most of us got our second doses, or is it something else?
Yeah, I mean, there's complexities to this. Remember, in the original Pfizer and Moderna trials, there were even people that had infections after a full dose of vaccine in those trials. So they're not unexpected from the get-go. But there are factors like the time from immunization where antibody levels may wean a little bit, the burden of COVID in your community. So if you're constantly exposed from a high burden in your community, yes, you're at higher risk of having a breakthrough infection then. Your age and other medical conditions where the vaccine may, wane a bit faster than the average individual. And then finally, the fact that we do have the Delta variant where there is a little bit more immune escape, not a huge amount, but more than the original COVID strain that we saw. And sort of all of these are kind of adding up to see a little bit more breakthrough infections than we saw at the beginning of our vaccine campaign.
Can I pick up on something you said there? You mentioned age, being a factor. Mm-hmm. What do we know about who is most likely to get sick, even if they are vaccinated?
Yeah, and those are the groups that I think likely, are going to be involved in a booster campaign. But we do know people, A, who have immune problems that make them not have a response to the vaccine, where we really didn't vaccinate them. But B, people at the extremes of age, particularly over the age of 70 and 80, where their immune system is a little bit more slow than the average individual. And again, their antibody levels may wean a little bit more, knowing that's the age group that's also the highest risk of COVID complications. They're the most at risk for these breakthrough infections. And again, the ones that we need to think about seriously for booster campaigns.
And just very quickly, I know we're not there yet, but what is your best guess for when the general population would start getting boosters?
When we start seeing fully vaccinated people who are healthy that start getting serious complications, absolutely a booster campaign is needed. Right now, there's not really any data in the world to suggest the vaccine has waned in those individuals. And so it's probably a little bit more time before we start seeing boosters in the general population.
Okay, Dr. Chagla, we'll have to leave it there. Thank you so much for your time.
No problem.